Our third session for today is focused on co-designing with our LGBTIQ community. And we have two presenters, Anton Cavalli and Chris Saxby. Thanks very much for coming forward. And just a little bit about Anton. He's a consumer representative and LGBTQI ambassador, also proud husband and specialty coffee roaster. Chris works as an allied health educator and has been with the community and oral health education team since 2013. Warm welcome to you both, Anton and Chris, and we look forward to hearing from you.
Thank you. Before we get started, we would like to respectfully acknowledge the custodians of the land that we are on today. We pay our respects to Aboriginal Torres Strait Islanders, elders and valued persons, past, present and future, and we acknowledge the strength and resilience that Aboriginal and Torres Strait Islander people and their ancestors have displayed in laying strong foundation for the generations that follow. For it is through building a joint understanding of land, water and community that we work together to reduce health inequities. So again, thank you. So we'll briefly introduce ourselves. Thank you for that introduction. So yes, I'm Chris Saxby. I'm a mother, grandmother, trainer of a crazy dog, as was mentioned, allied health educator and my profession, social work. I also identify, my pronouns are her and she, and I identify as a queer woman and I'm married to a woman. Over to you, Anton.
Hi, everybody. My name's Anton, as well. I've already had a nice big introduction there. You probably only took away the part that I deal with coffee. I'm a transgender male. For those of you that aren't quite sure about what that means, I was assigned female at birth, just to clarify. And I recently got married, so I'm a very proud husband. And I'm also now currently working along as a consumer with Queensland Health and Metro North. I'm really excited about this opportunity that it brings because also my journey, as I'll discuss briefly later, has taken me into hospitals many times. As a young child, I overcame brain tumor for many years, many operations through that, survivor of brain tumor, cancer, and then also, aside from my transgenderism, which is a process, now I'm also battling stage 4 cancer. So, but doing so remarkably well. But I'm really privileged to be here today as a consumer, and thank you for having us.
And in Metro North, we're very privileged to have Anton supporting this journey we're on. We'd also like to acknowledge Claire Harrison, who's a part of our journey that we're on. Claire is the manager of consumer and community partnerships within Community and Oral Health in Metro North. So who are we? I've heard a little bit about who we are as individuals. We're part of Metro North. We're called Community and Oral Health. It's a large health service on the north side of Brisbane. We have 13 different geographical locations, and we've got many different services within those locations. So just name a couple of them: Aboriginal and Torres Strait Islander Health, ACAT, so Aged Care Assessment Team, Brighton Brain Injury Service, Rehabilitation Units, a lovely Brighton Wellness Hub, which is where we do a lot of our work at the gorgeous Brighton Health Campus. You'll see up the top there is the North Lakes Health Precinct. On the right is the Nunda Community Health Centre, and then we have down the bottom, you might be able to catch a bit of a glimpse of the beautiful sea that we can see from the Brighton Health Campus. We also have post-acute care, hospital in the home, interim care, pulmonary rehab and specialised residential care. So really very diverse services within community and oral health. So why change the way that we were doing things? So these services have been going on for quite a long time. I've been with the service since 1993. So, why should we start doing something differently? Well, one of the things was when we last went through accreditation, one of the accreditors said to us, and he made a suggestion. He said, overall we were doing really well, but there was nothing, not one thing about our service that indicated we're welcoming of LGBTIQ plus communities. So, we had a piece of work to do there. And so we commenced that work. We also know from the literature that improved care is more than just improved clinical care. It's how we be with other people when we're providing care. So it's very much about the relational aspects of care. And of course, we know from the Australian Commission on Safety and Quality Healthcare that it's really important as health service organisations that we partner with our consumers to understand, what it is that they want from us as healthcare providers. We know also that consumers help shape the way the health service organisation operates and that we all benefit from that. And also we did start with a different model of consumer engagement. So this work started a couple of years ago, actually before COVID. And we were given, a small number of us came together, including Anton. Anton was part of that. And we were given a piece of paper that we were to fit our new model of care or our changes within the constraints of this. It was an organisational template. Now, that process didn't work too well for us at all. It was very rigid and it was constrained, and then COVID came along and we weren't progressing. Please, Anton.
I just wanted to add to that too, that though that wasn't working, it then became apparent that we could tap into 3 streams of knowledge. There's your textbook knowledge of what people know and have learned, and then there's the practicum knowledge of what the health professionals were applying and doing. But there was also the consumer knowledge where I came in with experiences and tapping into other people's experiences. It's not just me alone. I'm not the consumer. Sorry, didn't mean it that way. But having that was also those combining everything. It was like having all the avenues come together gave us a better understanding.
Thank you. So we moved on from there. Over to you, Anton.
Yeah. We moved on. It's back to me. Here I'm using the LGBTQ community as an example, but really the concept that we are working with encompasses any minority and disadvantaged group, including the Aboriginal and Torres Strait Islanders. We would all, and because, we would all like respect. Everyone wants to be respected, and we need to be individually valued and listened to and heard. I'm sure you agree with this. Being a part of society, of the human race, denotes involvement. And even though we can't control the world and everyone around us, we do have, to some extent, control over ourselves and to be able to govern our own lives. I feel that this is a basic human right, and no one can understand and speak for everyone. So this is why it's important to gain consumer involvement and hear everybody, have a voice for all.
Thanks, Matt. Thank you. So I guess I just wanted to say, we all had really good intentions at the beginning. And when I said we were given a piece of paper, there was good intention in that, but it just wasn't the way forward. So, and I guess one of the questions or one of the things we thought about, and sometimes we are asked, why LGBTIQ+? Well, we want to make sure that of course, our services reflect the diversity of the people that we provide services to. We had received that feedback from through accreditation. We are aware from the literature that LGBTIQ+ is recognised as a group that experiences poorer health outcomes. For example, in the last 3 years, we can say from the evidence that 30% of LGBTIQ+ communities were diagnosed with depression compared to 11% of the general population. Yes.
I'll just add to that too, that recognizing that this group experiences poorer health, but also the diversity itself within the group, within the acronym LGBTQI+, it's growing. There is also age differences within that and racial differences within that. Again, the Aboriginal Torres Strait Islanders, and then people with disabilities and the other disadvantages that we have to consider. So it's really a vast array in that acronym.
Thank you. And we're also aware that within those diverse groups that they're twice as likely as the general population to engage in self-harm. And when we consider transgender people, they're actually 6 times more likely. And that is in large part related to stigma, discrimination and abuse experienced by those communities simply based on the fact that they belong or identify as LGBTIQ+. So the other thing we did was we went and looked at the literature to try and establish, so what, given that we know that fear is a reason that people often will not identify, we wondered what percentage of our population that we were providing service to may identify with those groups. And we found that the literature tells us that there's been systematic reviews that with that we don't actually know. There's no accurate data to date to tell us. So we can only say, based on number of looking at the literature, that it's somewhere between 3 and 15% of the Australian population.
So it was an eye opener for me, this bit, because I don't have much experience with looking into the data and things of the medical populations, and when I did look into this, and I could see that the stats were very airy-fairy, they were vague, inconclusive, and this to me reflected a lack of importance.
So what we did when we got a bit more energy together, when things started to settle a bit after, well, not up post-COVID yet, but anyway, we made a new start. We threw out the old model. We threw out the old piece of paper and we started from the beginning. We started with a blank slate. We had, we identified 2 community leaders, Anton being one of them, and Carmel being the other. And we are, when I say we, I'm talking about Claire and I, approached Anton and Carmel and asked, would they be co-chairs of a working group, co-chairs with us? So starting from the beginning, having them positioned alongside us. And that's where we went from. So we had some initial planning meetings, and then we started, I guess what we come to the next part was using, I guess, what's sometimes described as a snowballing technique, where through peers and networks, we identified other members of our diverse communities to participate in our working group. Do you want to think about that, Anton?
Yeah, I just wanted to say that that when we were focusing on not so much what we knew, I mean, obviously that plays a part in it, but it was also who we knew, because when we got talking, we started realizing, well, actually, what about this and what about that? And bringing in, again, was diversifying our streams that we could draw from.
So currently we have a group of 4 So we have four employees and 4 consumers. 2 of the employees, and I'm in there, one have or identify as belonging to LGBTIQ, or 3 actually of the 4 identify as belong to LGBTIQ plus, and then we have a range of other individual people, consumers from different walks of life, and we are still in that process. So with it, I guess, of engaging with other people who may have an interest in joining our community group, to ensure that we are trying to get as many different lived experiences in our group as possible. And I guess it's important to say that while we threw out that bit of paper, we are very much connected to the organisation, and we'll talk a bit more about that in a moment. It is linked, I guess, through structurally and in governance ways to the larger community engagement committee that feeds up to executive and community and oral health.
Sorry. So once we threw out that paper, we didn't begin with any preconceived parameters. We were not looking to drive in dozers and tear down walls, but rather we were seeking tools and skills that we could then build paths with.
I think we have missed a slide. I'm just going to see if I can go back. No. Okay, so this was our shared goal that we came up with. So we're going to, in the next slide, just go through some of the actions that we're proposing to do, but it's really ensuring that we're working together. So we've got their planned actions. Some of these we've already commenced. So we're just going to talk about these together. We are planning to, and we've been invited to, as a group, present to the executive of Community and Oral Health, to the executive leadership group. So a small number of us, including Anton, will be talking about the plans that we have and seeking their support. We will also be giving them some examples of our lived experiences with the healthcare system to highlight where there are, certainly gaps still. Anton, over to you.
Yes. We've also developed some education opportunities for staff, and I've been heading one of those avenues, which is my own personal journey presentation. I've been, it's just over a year now, I've been holding regular presentations online through Teams with doctors and staff. And it's been wonderful just to be able to share my experiences. It's an honor and a privilege, but also to help explain and educate people on the issue of the transgender plight, and people and some of the differences and difficulties that we would have, especially in the healthcare system, because there are many, as you can probably imagine. So yeah. Oh, and I'm the next one too. So the next one was also setting up a space. I thought of the idea of having a rainbow room. We could call it anything else. I don't know. At the moment, that's the term we sort of given it. But just having a visual presence space at the Brighton Health Campus that would have that people could go to, whether they are within the organisation or consumers from outside, and feel safe to ask someone for some support or some questions, to get some resources, to be able to point in the right direction and assist them. I'm on this one too. Facilitating linkage by enabling access to, oh no, that was you. Oh yes, so sorry, I need prompting. Oh, sorry. The different services too that I've been able to help from being in the community and obviously accessing services for myself during my transitional period and then helping other people to do that. I've come to have quite a few resources on hand that are local. So we were able to then contact various resources and ask for flyers and brochures, you know, extra support, things that we can also incorporate and use to help our clientele.
Thanks, Anton. I guess I just want to mention about the education too. Anton's been providing those sessions for at least a year now to our staff, and they've been through via Teams when we weren't able to do the education face-to-face, and now more recently face-to-face sessions, which has been great. We also, in terms of resources, we're ensuring that we have a voice in other activities within the organisation. So for an example of that is White Ribbon Day is coming up soon. We know, sadly, that no community is free from domestic family violence. So we're going to have a diversity stall at our White Ribbon Day in Community and Oral Health. And there'll be a number of us who will be staffing that stall. The other things that we're planning to do, and we have made some progress already, is we're looking at completing service audits. We've partnered with our quality and safety people in community and oral health, and they are open to that. And we're looking at using the resources developed by Pride in Health and Wellbeing, their national resources, so the Getting Better audit tool, which is a gap analysis self-assessment tool that we can use to identify where we've got gaps in our service, and that we will, as a group, then develop an action plan to address, you know, the areas that need to be met. Within that analysis tool, it covers 9 different sections, including like staff development, engagement, communication, organisational readiness, staff development, intake, and data management. So it's very broad, and it'll really give us a good baseline of data to know where we're currently at, so that we can, you know, do that again and see, you know, hopefully that we've made changes. And the HWEI scoring guide it stands for the Health and Wellbeing Equality Index. We also hope and plan to, into the future, review our consumer literature that we have to ensure that the images and the language is also inclusive of our communities.
Changing how we do consumer engagement. Well, we've let you know this now. I just point out a very good-looking young man made that quote. I don't feel like the outsider. I feel valued and a part of this. I really meant those words. I really mean those words. It was amazing joining in on the team and being included and valued and treated like I am a valuable member that could contribute something big. And it's encouraged me a lot. Just to the side there, the little box that says recognizing that improving care is more than improved clinical care. This is really important, and this was really something I'm passionate about too, because I've experienced a lot of it. And things have definitely gotten a lot better over the years as well. There is improvement happening, which is great, but there's always room for more. And I will just give a brief example of when I was in hospital as a patient in one of my many stays, and one of the nurses, it was clear that she didn't like my transgender situation. I don't know how else to put that. She was transphobic. She didn't have to say it. It wasn't her actions as such, as far as direct, that would have been wrong, and well, I would have got rid of her. Not in a bad way. I just asked for someone else, that's all. But honestly, she made me feel, she came in, she ticked all the boxes and she gave me the pills, but it was in her face. It was in her body language. It was in her care or not care factor. She didn't go out of her way. She wasn't really helpful and she didn't uplift me or upbuild me or anything like that. And I was kind of starting to dread her. I used to sing in my head. I was singing in my head, "You're as cold as ice," to try and give myself a little bit of a. But yes, that has a big impact though on the recovery of the patient. I mean, I was someone who I think has a pretty good mental outlook. I'm positive, so I was able to overcome a lot of it. But I wonder about others that would have even been in maybe perhaps more of a compromised situation, mentally even had poor mental health, how they would have dealt with having someone like that coming in to their sick bed, treating them, but not really treating them. Is, you know, that's where it really identified to me that it's about our personal approach as well as what's your work ethics. You know, like you should be being professional and giving the best care to whoever is in that bed, regardless of what they're doing, because what they do in their personal life or who they are, that's not your concern. Your concern is the individual, the human. And I just think that there's some lines there that need to be unblurred.
Thank you. So it's great to hear that Anton feels part of what we are doing, because that's how we've made a difference when we tipped out the old model, and we're working together in partnership. And I know there was a question to the earlier speaker about, and it was around health literacy. And I guess, you know, Anton and other consumers in our group can tell us about the experiences they're having in the health system. And it's about, we can then look at our systems and look at, you know, ask them, what do we need to change? So it's I guess a top down, bottom up, both. It's a connected approach where we're bringing, you know, all the good things together and working in true partnership. Even as long the meetings that we hold, one of our consumers is traveling around Australia at the moment. So fortunately, you know, we have teams. We've really made sure that we enable access so that everyone can have a voice, and the way that the meetings are facilitated to ensure that everyone does have a space to be able to speak up and let us hear what's important.
Well, our journey has started and it is a shared adventure. Though our previous attempt was quite closed in, our group meetings now are much more open. And it's really exciting. We have a good vibe, you know, to quote Marbo and the vibe and the Constitution. We have a very good vibe within the room, and we always feel uplifted, which is such a great thing, especially when you're going, you know, to essentially a working committee or something. I feel very positive about the direction and the positivity, the possibilities the possibilities that we are discovering and also creating. Thank you.
So we've just got a couple more slides. We just wanted to just say that we believe our model is of engagement is transferable. That, you know, other committees could do this. They could start with a blank slate and a broad area of inquiry, not a predestined, you know, end place to land on. We have entered the relationship with open mind and preparedness, as you've heard from Anton. We've set expectations from the start with setting up the structure of being co-chairing. We've tossed out the hierarchical model. We have thrown everything on the table, and we've been honest about what we can achieve right now and what we can look at achieving into the future. We guide each other, and there's shared responsibility. We're involved all the way through the journey, and yeah, we're clear about our limitations as well, but we also want to see that there's horizons ahead. What we can't achieve this minute doesn't mean we can't achieve soon.
In piecing the group together and recruiting others, obviously we had to sort of work out the dynamics of the group and how it was all going to work in. It takes a little bit of time to get that all together and get comfortable. Then for people to feel that it is a safe space, a nice environment as well for us to discuss things in. And then also, above all, it's the behavioral expectations that we have of each other, that we know that we all respect each other, we all value each other. I guess that's one of the biggest priorities that you would need in establishing a group like this. It's our focus was to have those key areas of behavioural that we would all abide by, like our code.
And Anton's just going to summarise in a moment, but I guess we have this in Queensland Health. It says for health workers, it's okay to be you. And we want everyone that we provide services to feel that it's okay for them to be who they are too, and to know that they'll be treated respectfully and kindly.
Yep. And so in summary, I just wrote down 3 key points. Attitude, having an open mind, and being respectful and being motivated in what we're doing. Recognizing the value of the enriched and diverse skills that we're working with in a mixed group. And then also the need to allow, and this is important, the need to allow room for change and growth, not being so held to one thing. We're thinking that was going to work, but then it doesn't, and to be able to then move on and seek out better ways of doing it and changing.
Thank you.
Thank you. Thank you, everybody. Sure. Yes, please.
Hi, thank you very much for your presentation. It's wonderful. My name is Heather and I'm the State Manager for AHPRA. We regulate health practitioners. Anton, I just want to say thank you very much for sharing your journey and demonstrating such resilience. It saddens me to hear that story about the nurse, how she really didn't care for you. I would just like to know, did you feel comfortable in ever making your feelings known and complaining to other practitioners or to the health services who are supporting you, or to someone outside of the health service?
Yes, I did. I didn't, with the particular nurse I was speaking about before, that particular example, I didn't say much about her to anyone other than when I was leaving, I did let a couple of nurses at the front desk know that she was a bit difficult.
Yeah.
Aside from that though.
But you knew the process.
But I knew the
to make
process,
that
and in other areas and at other times where I've had worse treatment, sometimes not with regards to being even to being transgender. Sometimes it's been a case of not doing their job correctly, and not respecting the patient's rights either. You know, it is my body after all, and I want to have that kind of respect when someone's handling me. So, and I did go and complain, and I did find out also where I could go to complain. I know that things like in Redcliffe Hospital, they have Ryan's Rule, and a few other things and hospitals usually have those things so I've always looked to that if I needed it, but thankfully it hasn't been frequently or anything.
Great, thank you.
Chris Hicks here from Westmoreton Health. Thanks for your presentations and your resilience and tenacity to take on the organisation and do something different. And that's, I think, one of the lessons of COVID. We've got to do things differently. My question is similar. To what extent do professional standards, you know, in your discussions, was that raised? And at least having, you know, we've got professional standards across the APRA professions and the non-registered professions. They're all there. But then there are practitioners who choose not to do that. And to me, that's unprofessional conduct. So I guess my question is, when you're having your discussions, where has that come up? And do you have any advice for someone like me working in a health service as to how do we raise the profile of your professional standards to provide a culturally safe service? And I guess it's more than just LGBTQ+, but across a range of other sectionalities. But I was just wondering whether that figured in your conversations and how you approached it, if it did.
I can't say it really did. I didn't go that in depth into the I don't even know the words for it, but really, I didn't go that in depth into the medical, you know, protocols of the training of the nurses and doctors, and I don't know what that is, but I know as a basic human rights what people should be doing and giving, and it's when that wasn't met that I feel that there's a need to voice that and say, okay, hey, this is, you know, it's important because you can do damage. Sorry, but yeah, I don't know how else to answer that. Did you?
And I'm just wondering if your question is about our current consumer work that our committee at the moment about standards. Yeah. So we're in the embryonic stages. However, as I mentioned, when we present to executive, we will be providing examples of lived experience. And part of my role as an educator in orientation and all of our staff education is linking back to our professional standards of code of conduct. It is taken very seriously, but it's important that we have those examples of lived experience so that we can highlight it. And I guess we're still at the stage where it's within the next month that we'll be doing our first audit. So that is where we'll be able to identify where what gaps do we have, and then working together to look at how we're going to address that, looking at not only the lived experience and what it feels like to experience that, but what are the organisational and the professional and the regulatory requirements that we will link those actions to. I hope that makes sense. Yeah. Thanks.
We've just got a couple of online questions I'm going to ask Alison to see if we can kind of piece them together. Just I know time's running out, so we'll just hear online questions.
Okay, so this one is from Elizabeth, and she asks, can you say more about how you are evaluating the impact of these initiatives on staff and care? For example, are you seeing a reduction in homophobia, transphobia, and then care more LGBTQI plus inclusive?
I would just say, firstly, thank you for your question. But we're not seeing the reductions just yet, because we haven't put any work models out there and that also answers the question that I had before too, that we're trying to devise a better way of finding out how we can improve. And when we have those answers and those tools and then that's when we're going to start to implement them. And then that's hopefully when we'll see some real change.
And as Anton said, we're not at the point of evaluating yet. However, I would say that we're at the point of awareness raising, that first stage, and that's what's being achieved through the education that Anton has been doing is we've got nursing students. So we're getting, we've got to have diverse audiences, but we're getting our people, you know, the staff in before they've actually even graduated, where they're hearing stories of the impact of care when it's not delivered in the right, you know, respectful way. So we will, I guess, know at some point, and I'm sorry, we're not at that stage yet, but we'll be able to measure, are we making a difference once we do our baseline and then we do our further audits.
We might have to call it there. We're really at time. Can I just again thank Chris and Anton? Thank you so much for your honesty.